hello, do these things talk to each other? And can we look at it holistically and say, can we bring a hospital home? If it moves, digitize it. If we do that first, that will dramatically change the delivery of care. They're not going away without a fight. Well, can an LLM maybe summarize that for me? That would be huge. I mean, some doctors are using WhatsApp to connect to their patients. Most of the time, the incumbent or the person they're trying to sell to didn't even know they had that problem. Impact one life positively in this life, and you'll come back as a better person in your next life.
Hi, and welcome to our new episode of Digital Health Interviews. I'm super excited and happy to introduce our today's guest. His name is Ritesh Patel. Hi, Ritesh.
Hi, Alex. Nice to see you.
It's likewise.
Yeah.
For those few who do not know in digital health, of course, who do not know who you are, could you just please tell us briefly about your background?
Sure. So I joined Fin 3 years ago, actually 3 years ago on Monday, yesterday. So there you are.
Congrats.
Thank you. To lead the digital health practice, global digital health practice. Prior to that, I spent 7 years at Ogilvy in New York, with 3 of them being in the consulting group, where Ogilvy Consulting was basically doing a lot of work around digital transformation for healthcare clients, where I led a big project with a pharma company. And then before that, many years, probably 6 years at Inventive Health, which is where I got my start in healthcare. So started out in the CRO world, clinical recruiting. I was supposed to digitize it. I failed miserably, couldn't even get rid of the fax machine. But I think they're starting to digitize clinical trials now. But in 2010, when I joined, it was interesting. So my background has been very much in the last, since 2010, digital health. I have a very narrow lens, and my motto is, if it moves, digitize it. So figure out how to do that. So that's basically what I do. We work with health systems, we work with payers, we work with medical device companies, we work with startups. We've got a sort of an ecosystem of VCs that we work with as well. But really, it's around that intersection of how do we get a big corporate to innovate, or a big health system to innovate, and then find a partner or a startup that can do it for them. So that's basically what I do.
Very interesting. So basically, you've been witnessing the early days of what we now call digital health. And since that, you've probably gone to hundreds of conferences around the globe. You've saw and listened to thousands of pitches of innovators, and probably most of them decided that they're going to change the whole healthcare system. So are you satisfied with the speed of adoption of technology? And do you think that technology actually improved healthcare system?
So as I said, my motto is, if it moves, digitize it, right? So here's the issue. Every startup I meet, every founder I meet, they always have this same situation. They come in and say, I've got this perfect solution for this problem. Most of the time, the incumbent or the person they're trying to sell to didn't even know they had that problem. So that's one of the major issues. Is you've got $1 trillion industry in this country, lots of innovators and entrepreneurs looking at a real point solution of something that they see a need for, but it's not connected to the ecosystem in any way or the broader use case of what it will do. I can give you an example. Everybody's now talking about AI. Oh, it's just a silver bullet, right? 10 years ago, mobile was the silver bullet. Everybody thought it was going to be mobile. The mobile is going to revolutionize the world, right? It did, except in healthcare. Same thing with AI. It's revolutionizing the world, except in healthcare. Because what we try and do is we go after the technology and we say, here's the tech, as opposed to a problem. And oh, by the way, the magic is the tech, but I'm not going to tell you about the magic. I want to tell you how I'm going to fix your problem. And that business response to that problem is what I'm going to help you with. So today, nurses are completely burnt out, as are doctors. There's a company that provides an outsourced discharge solution. They lead with, our AI is going to change the way you do discharge, as opposed to coming in and saying, I'm going to help you fix your nurse burnout problem. That's what I mean, right? So I think tech has the capability, But I think the way we apply it in healthcare is not a tech solution, but a problem to fix in a business or a delivery of care that tech enables. And that's where I think the message is sometimes a bit misguided.
But do you actually feel that something is like dramatically improving in the system?
I believe so, and I believe it's in 3 areas, and I think it's expanded in the last 3 years or so. I think COVID helped dramatically because it opened people's eyes in every industry, but particularly in healthcare. Telehealth been around since the 70s, but it got adopted during COVID because we had to, right? Necessity is the mother of invention. So I think, over the last 3 years, some of those things have matured now where we hurled into it and now it's become normal. Telehealth, I think, is changing the delivery of care and is providing healthcare to people that never had access to it before. So that technology is helping a lot. Where I think, for example, AI is sort of chasing consumer solutions for AI. I'm going to have AI bots treat a patient. Maybe look at it from how is AI going to help me with the doctor? Can AI make the doctor more efficient? For example, can you create something with a large language model with an electronic health record, where when I walk into the doctor's office here in the US, first 4 minutes, the doctor's looking through 9 Epic screens to figure out what they did with me the last time I was there. Well, can an LLM maybe summarize that for me? That would be huge, right? So I think tech can do it. And so on the consumer side, consumer adoption. I don't know anybody who doesn't have an Oura Ring or an Apple Watch or whatever, right? I think on the B2B side, it's not how do I change the doctor-patient relationship, but how do I make the doctor more efficient? Or how do I make the nurse more informed? If we do that first, that will dramatically change the delivery of care.
I totally agree. Since I moved to the US, I've been experiencing the US healthcare system personally, unfortunately, way too many times.
Yeah.
And I feel like I started to understand how things work better now. And let's face it, there are lots of problems in the US healthcare system. But I think one of the problems that lots of people are not talking enough is lack of communication and poor education of how to navigate through the system. And I think all those big corporations like healthcare insurance companies, health systems, they're not really super incentivized to improve that transparency and to make life easier for patients. Probably their profits would decline in that case. So, and you're a communication person, like you've been in advertising marketing for years. How do you think we should change that communication, and who should be like the initiator, let's call it a client, who orders the communication strategy?
So here's what I learned, right? So when I moved here from the UK, I had this vision that I could change the world in America, right? So I know where you're coming from. And then one day, the guy I was working for, so this was a travel business that disrupted the entire travel industry when computerization occurred. And I remember sitting one day saying, this is a better way to do this. I just don't understand why people aren't doing it. And he sat me down and said, look, you're in America now. The only thing that matters is the dollar. If you could figure out where the dollar is, how you can make it or how you can save it, that's the only thing you should worry about. So I would submit that's the same issue in healthcare, right? Look at the infrastructure. Who are the people who benefit the most at the moment? The insurance companies benefit the most. You look at United Health, one company out of Aetna, Cigna, all of these guys, $85 billion a quarter. They're not giving that up easily. They won't give it up easily. So you can be a startup entrepreneur and completely figure out how to disintermediate those guys. They're not going away without a fight. And that fight usually is that entrenchment that you have, right? So healthcare and financial services and a couple of industries where money, huge amounts of money is involved here in the US. The only way to make any meaningful change is to do it at the grassroots level and then bubble it up, right? And you need policy folks behind it, you need the people who are doing things behind it, and you need the consumer who's consuming the things behind it. If those three align and you can figure that out, then there's momentum. But if you're only going after prior authorization as a technology solution, you're never going to make it, right? Because it's not in their interest to approve something, right? So that's what you've got to think through. I get really frustrated. I have a doctor's appointment, I get a call, I then get a text message to remind me, then I get a text to fill in the portal that I have to log on to update my information, which has been the same forever, right? Then I get to the office and I have to fill in the paperwork and sign the form, right? Like, hello, do these things talk to each other? And the answer is no. So I think there are some, if there are entrepreneurs who are watching this video, if you can take that process and integrate it, you've got huge amount of potential, because that's one process that needs to be integrated from an experience perspective. Don't go after the $80 billion Cigna, but go after the $10 million press gainy who's doing the satisfaction surveys and the text messaging. The other bit is the rules are changing, which will help. CMS has done a really good job in methodically starting out with the digitization of VHRs, now to the open data rule, right? So I didn't get it until I saw it to now. So digitize everybody first, then start putting it together in a place that everybody have access to it, the doctors and the nurses, then figure out a way to get it to the customer, the patient, so patient portals arrived, right? Now make it open so anybody can have access to it, the open data rule. So they've been methodical since the Obama days from a journey perspective to take the big things on. So we as entrepreneurs now, with the open data rule, finally have the ability to go to an EHR to get access to a sandbox to do things, right? That's the end goal. And it's the same in everything else that we do in healthcare. What I'm finding is we have to be methodical and have a long-term view. Problem with that is some VCs don't like long-term stuff, right? So that's the dilemma we face.
Can you elaborate a little bit about the open data rule?
So the open data rule is basically, it's the culmination of this whole CMS implementation of digitization of the healthcare solution. So the last piece was you digitized it all, but you gave power to a small number of people who now held the data. And for you to get access to the data would cost you hundreds of thousands. Epic, I believe, 2 years ago were charging up to $200,000 to get access to their system because they were the gatekeeper. What the open data rule says is you cannot now do that legally. Before it was a guidance, then the rule said no, legally you can't do it. And if an entrepreneur tries to get access and you say no, and there's no good reason, that entrepreneur can sue you and take you to court. That's the rule that's been put together. So the stick has arrived. Before it was all carrots, now they're putting some sticks in place so that we can actually get things done. So that's what the open data rule is all about.
Very cool. At one of my healthtech events, actually here in this office, you did the opening talk, and you talked a little about value-based care, and I felt you were a little skeptical about it because apparently, again, some big players are not super incentivized to adopt it. Can you also tell us more about this?
Yeah, so I love value-based care, the model. I think it's a great model, and I think it should definitely be adopted. The problem is the infrastructure of the data that you need to ensure that you're doing the incentives in the right way, right? Value-based care is based on a set of data you have to then measure against so you can get the money you need to then provide it, right? So let's say there are systems, there are companies that do it really well for a specific audience. For example, Scan Health has done a great job of value-based care for the Medicare population that they cater for. But they're a small operator. They're only in California, Arizona, and Florida, right? If you're a an HCA or a LifePoint or an Ascension, you're talking $50, $80 billion corporations, right? They don't have the data. So value-based care needs a lot of data to be then able to create a benchmark that you need to then go to the payers to say, here's my benchmark. If I do this, this is what I'm going to do for it, right? A lot of those people don't have those connected systems. So for example, I have 3 things that are wrong with me and 5 comorbidities. The comorbidities are in different lab systems and in different things. How am I going to do the whole measurement of my value of the care that I've provided if that data isn't there for me, is what I'm sort of concerned about. So there are different models of value-based care, right?
Doesn't health insurance companies have most of the data?
They have all the data.
Right, but at least I thought that for them, healthier patients, they need less money to.
It would be, right?
So it would make sense for them to speed up adoption of.
You would think, right? So what do you think the margin is for a hospital? Do you know what the margin of running a hospital is? It's about 1.5%. I make more money at the little curry house I have down on the East Village than a hospital does, from a margin perspective. So that's the dilemma. You've got all the data and the money over here, but the guys who actually have to deliver it all have to manage that margin really well. And the two haven't come together yet on an agreement of a model that would work for both. Currently works for one, not the other. Right? So that's the issue. So if you're a small operator, and Scan isn't that small, but they're small enough where they can manage that. They can manage the cost, they can manage the patient inflow, they can manage how much margin they do, and then they can take that, right? And then there's all the incentives that are put on top of that as well. But if you're a multi-system thing like a University of Pennsylvania Medical Center with oncology, cardiology, radiology, maternity, how do you put those together in a way that works? So that's the issue.
Is there an opportunity for innovators?
Big time. There are data innovators. There are, I would say the big area is around arbitrage of the cost model in a big way, right? Use some financial services techniques to bring it to the insurance players and the providers, right? That's how Merck Medco was born, which now is Express Scripts, right? It was a complete arbitrage model on receivables of pharmacies that became Express Scripts, that became a PBM. So two Citibank guys decided, hey, all these pharmacies are sitting on about $70 billion of receivables. Let's go buy them. We'll pay them up front, and then we'll arbitrage the rest. And that's how Express Scripts was born. So, right? So that's, I think, the model.
So I know you're also really passionate about access to care, especially in rural areas.
Yeah.
What do you think are the main barriers right now, and what kind of innovations look the most promising to you to improve that?
Rural health is a very big passion of mine, simply because we take it for granted in the cities we're in, and then you go to a West Virginia or a Wyoming or a Montana, and you see, somebody has to drive 400 miles to the nearest hospital to just get basic care, right? So is there a model? The problem has been infrastructure the whole time in this country. This country is vast. And the spending has not been there to provide just basic connectivity to some of the parts of this place. You can drive north of here on 95, and when you hit Greenwich, and between Greenwich and Stamford, you get no signal. And Greenwich is the richest part of Connecticut, and there's no cellular signal on the highway. You literally will lose your call. You can't do that for healthcare, right? So the infrastructure has been bad. The infrastructure bill that was passed and the money that's being doled out to the states to put into that infrastructure from the Biden administration is going to help a lot, because that's going to provide the capability, hopefully if the states spend it the way they're supposed to, it will give the infrastructure we need to get to those remote areas, either via cellular or by fiber, right? For example, I think Louisiana got $230 million from the infrastructure bill. So put that funding towards putting that infrastructure out. Once the infrastructure is there, then bring the innovators in to start saying, what can we put on top of this infrastructure to deliver care to people? Everybody's going for the usual suspects, telehealth. But that's not the answer, right? That's not really the answer. The answer is, can we look at it holistically and say, can we bring a hospital home? Can we bring a GP in your house? What do we need to do that, right? So one guy I met, not a digital solution, but I loved it. He created a kit. So basically, based on your need, you get a little red bag that appears from your hospital with all the things you need in there. So if you're a chronic patient, there was a handheld EKG, a stethoscope, digital stethoscope, a temperature, whatever you need, a blood pressure cup. And a little card, step 1, do this, step 2, do this, step 3, do this. But he needed connectivity to do that, right? So take that kit and then apply it against the infrastructure. Now I'm giving you chronic care at home. You never have to leave your house. That's the kind of thing I think entrepreneurs should be thinking about.
If we take the scale from 1 to 10, the infrastructure part, where we are in terms of adoption or improving the infrastructure?
Yeah, so the bill was passed last year. So, the funding is now being slowly put out there by the feds. States are starting to get the money in. Then the next step will be for the states to then give, grants out or to partner with companies. The biggest player in the market at the moment that's going after all this money is Verizon. They have the capability to do that. But you've also got, a number of other players that are looking at this from how can we play to be the infrastructure owner. The question will be, how much will they charge for that? So the grant is being given to build it, but then they're going to have to create a business model around the return of investment to keep it going. And so I think Verizon is probably the biggest player in that arena at the moment. Once they roll it out, then it's, I've now got capability. I went to the Sioux Nation and I followed a nurse around for a bit, and then we drove 300 miles to a Starbucks. So she has an iPad, she goes to the nation, she does all of her nursing stuff, collects all the information, then drives 300 miles to Starbucks to be able to upload it to the EHR to the hospital. Imagine if you were able to give her 3G capability. Just 3G, it doesn't have to be 5G.
Right.
3G capabilities at the nation, then you're done, right? So that's the promise. How long will it take? It depends on each state. This is the problem with the US model. Each state is unique and different, right? So there's no federal mandate. So 5 years.
Yeah. As I mentioned before, you've gone to lots of digital health conferences around the globe. Do you see any differences in terms of tech adoption in healthcare in different places?
Yeah, I do. So I would say there are pockets of places that are doing incredible things, and there are pockets of places that are worse off than the US, right? So if you look at Eastern Europe, particularly places like Lithuania, Estonia, Moldova, those guys are way ahead. Ukraine, way ahead in a lot of environments in healthcare. I think Estonia was the first one to actually put everything on the blockchain, way before anybody even thought about it, 2016, 2017. So where there was no infrastructure, where the Russians didn't have anything, it was all old. When the new states came into being, they just leaped. They just went to mobile straight away, right? They adopted those new technologies. So I think if you look at Eastern Europe, if you look at places like Turkey or, in between, amazing stuff. The Europeans, traditional, the G6, really tough because they've got infrastructure already there, but it's the governments and the policymakers and the people who have already got the entrenched who are fighting it, right? So I think there's changes, but slow. Germany's very slow. UK is a little better, but again, they've got the same issue as the US. Every hospital has a different system. You would think as the National Health Service, they'd have one system. Nope, it didn't work that way, right? Same with Germany, same with Italy. US is the same. Where things are behind, Latin America, it's really bad, right? I mean, some doctors are using WhatsApp to connect to their patients. I wouldn't trust my patient history on a Facebook app, but there you are, right? So I think it's degrees. Africa is booming. If you look at some of the innovations that are coming out of Rwanda, Ghana, Nigeria, incredible stuff going on. From delivery of care to how you pay for it, using mobile currency, wallets, digital wallets, underwritten by AXA. So Africa's got some really interesting models that they've put together. So, but I think overall, from a technologist, a digital guy perspective, Eastern Europe and Rwanda, Ghana are where most of the innovations are happening at the moment.
That's good to know. Talking about going back to South America, I know that lots of startup founders actually trying to get there because the market is not regulated at all, and that kind of gives their ambition to start adopting their tech. Is that a good strategy, you think?
It is. The problem, again, is that the volatility of the political environments is where you have the problem. Brazil for a long time was doing pretty well, and then the government changed, and all of a sudden entrepreneurs in Brazil are having a really tough time. Similarly, there was a lot of work going on in Chile for a while. Where I would suggest, if entrepreneurs are looking for South America, is go to Mexico, Colombia. Colombia is booming at the moment. There are new models coming out of Colombia all the time right now. The big populations are Argentina, Venezuela, Brazil, but the uncertainty, the political uncertainty at the moment is to be avoided, unless you live there and you can't get out and you have to do something, right? Private hospitals-wise, Brazil has got the largest number of private hospitals, so there's a lot of money there, but it's the political instability that's the issue. So Colombia, for sure, is a place to start. Mexico is the other.
You've been in this industry for a really long time.
14 years.
It's probably really hard to surprise you with some innovations happening. What actually motivates you in your job, in your daily job? And I know your continuous enthusiasm, and if people check, Ritesh, your Twitter account with saying good morning Twitter every morning, it's fascinating. It looks like you're still super motivated even after 14 years. What actually does motivate you?
It's a great question. What motivates me is this. And I was growing up, my father used to always say to me, impact one life positively in this life, and you'll come back as a better person in your next life. In healthcare, if you impact one human's life, that's great, right? And what motivates me is the amount of entrepreneurs that I work with or I meet who are super passionate about the thing that they're doing, that how can we help them make it? How can we help them achieve that passion? Those are the two things that motivate me. So many smart people trying to get this stuff done. So why don't we help them? Why don't we make it happen? I do a monthly curry club where we get together with a bunch of people. We've had businesses start there. We've had, businesses fail there, unfortunately. We've had money raised there just to get people going and saying, look, if we do it together rather than you on your own and you on your own and you on your own, if the four of us got together, we could make an absolute change. And if it impacts one person, whoa, look at what we did, right? That's what motivates me.
Very inspiring. At the very end, we ask our guests to give some piece of advice to early stage startup founders in digital health.
I would say you have a great idea. You go figure out and look at the market. You come up with a thing that may work to fix what you think is the problem. When you're there, go meet with 7 other people and test it with them first. Before you go full on and go raise money and bank your children and your house and whatever else you do because you're so passionate about it, just ensure that what that idea is, that you test it outside of your bubble. Go find somebody else and just run it by them. My rule of thumb is, would you do this? If you don't want to do it, if you would never do it, or give it to your wife or your husband or your sister or your mother. If they don't do it, then don't do it. Change the model, right? That's the advice I would give.
Very cool. Thank you so much.
Thank you, Alex.